Hey everyone, Azim here. We're going to go over some of the basics of the anatomy of the head. Some external features. We have the eyes. This is the ocular or orbital region. We have the nose. We have nostrils. In animals, they're called nares. Other animals besides us. Here's our mouth. The space of the mouth is called the oral cavity. The space of the nose is called the nasal cavity. Within the mouth, we can find the tongue. The tongue has bumps on them called lingual papillae. Lingual papillae are for gripping, for grabbing onto food, for licking, and located on them microscopically, we have taste buds. And so the papillae maximize surface area for the taste buds. We have our teeth, of course, and the teeth are for chewing. But when we chew food, not only do we use our teeth, we use our tongue and mash food to the roof of our mouth. Now the roof of our mouth, you can see that there's bone here. This makes the roof of the mouth hard. So this part of the roof of the mouth is called the hard palate. It also forms the floor of the nasal cavity. And the hard palate, like I said, is made of bone, deeper to the soft mucosa. And the hard palate helps us break food down. And what further helps us break food down is the ridged lining of the roof. You can feel with your own tongue at the roof of your mouth, it's ridged. Those are called plicae, P-L-I-C-A-E. And these ridges, again, help break down food, just like if you were to have those ridges on a washboard, if you've ever used a washboard to wash clothes. You can see that the bone ends about here, and then now we have mucosa and muscle. This posterior part of the oral cavity leading to the pharynx, this is the soft palate. So we have the oral cavity and then the soft palate, which is basically where the pharynx starts to begin. This is for swallowing. We don't want any bone here because we can't have any muscle. So instead we have muscle that helps with swallowing food down to our esophagus. When we swallow food, from the oral cavity down the pharynx, down to the esophagus, we want to ensure that food goes down this way, down the esophagus, and not this way to our respiratory system. This is the larynx, which goes down to the trachea. This piece here, this is the epiglottis. The epiglottis literally means covering the glottis. Epi means on top, glottis is the hole here. So this is a flexible piece of elastic cartilage that comes down when we swallow food so that we don't aspirate food into our respiratory system. We can see in this mid-sagittal cut our brain connecting down to our spinal cord. We call it spinal cord once it goes past the end of the skull here. So all of this is brain. And here's the spinal cord. Collectively, the cavity that these two sit in, those are the dorsal posterior cavities. The brain sits in the cranial cavity, and the spinal cord fits in the spinal or vertebral cavity. They're protected by the cranial bones and by the vertebrae. So a quick recap on what we see superficially. We have the eyes, the nose, the mouth, the ears. One thing I didn't mention about ears, why are they shaped this way? By having these rounded, almost funnel-shaped auricles, A-U-R-I-C-L-E-S, auricles, they help catch sound from different directions. If we didn't have these auricles, we would still be able to hear. It would just be harder to locate sounds. All right, that is a quick overview of basic anatomy of the head and internal cavities. Thanks for watching.